Hi, my name's Dr. Marcus Spry. I run a dental practice here in the UK, and a big welcome to my YouTube channel. Hi, today we're going to look at how Invisalign braces actually work. My practice predominantly does cosmetic dentistry, and we do a lot of Invisalign treatments for our patients, and they absolutely love it. And I think it would be important to show how it works and how it's different from a regular brace. So how exactly does Invisalign work? Well, I think probably most of us are familiar with a regular brace. They've got metal brackets which have a wire running through them, and there's a little elastic which holds the wire on, and they do a fantastic job. The problem is that everyone is completely aware of the fact that you're having orthodontics done, and that may not be to your taste. So if we put that to one side, an alternative would be to have tooth-coloured wires and brackets, but it's still fairly obvious that you're having something done, although less so than the metal ones. But then there's Invisalign, and this is an Invisaligner, and the way that it works is that you have some scans or some models taken of your teeth, and as you can see on this particular model here, the teeth are crooked. And then the scan is digitized and put onto a computer by Invisalign, and at Invisalign they move the teeth straight on the computer, and then the computer works out all the little stages that must be necessary from having your teeth crooked to having your teeth straight. Okay, and as a result it can then create little 0.2 millimeter step jumps between this crooked and this straight, and each of those steps is printed digitally as a model, and then they vacuum form these aligners over the top of that. So when you put an aligner on, and this is what this is called, that is 0.2 of a millimeter straighter than your teeth. So it has to stretch over your teeth, and the rebound of that stretch actually moves your teeth into the straightened position. So you have a series of these, you change these every week. So you have a series of them moving along. It's a little bit like stop frame animation, you know, that they would use to make a cartoon or a puppet appear to move on a movie. So you would have a series of these along, and each one of them would be getting straighter, and you would wear these progressively until you get to the last one, and then your teeth are perfectly aligned and straight. And that might take 10 or it might take 50 of these aligners, depending on how crooked your teeth were in the beginning. So that's basically the mechanics of Invisalign, and when you have it in your mouth it will look a lot better than wearing a brace if that's your particular way. There are some disadvantages of Invisalign. One is that you can take it off and maybe you don't wear it if that's the way things are, and then it can't work, whereas if you have a brace it's fixed to your teeth and you've got to wear it whatever. The other thing of course is that you could lose this, where it's very unlikely that you would lose the brace. So there are some disadvantages to it, but my patients that particularly want not to have a wire love it to bits.